All right, so tell me your name and what you do for a living.
My name is Frank Ebert. I'm from Germany, and I'm a chiropractor and naturopath.
So how long you been practicing, Frank?
In practice, I'm like 20 years now.
Mm-hmm. So how did you hear about the ASTR treatment?
I heard on YouTube.
Mm-hmm.
It was a related topic,
Mm-hmm.
and I enjoy related topics, and very often I find real precious information with them.
So what make you decide to come from, you said Germany?
Yes, Germany.
Okay, what make you decide come all the way from Germany to, what make me convince you actually to come here to the States to take ASTR class?
Yeah, so I watched all the videos, and it really made sense what I was seeing. And since it made sense, and I was curious on this magic tools you have, and I said I'd give it a try and come here just for the course.
So now the course was like 3 days. We finished all levels, ASTR levels. So what do you think about taking ASTR class after the 3 days?
It was very intense. I liked it a lot, and it was necessary to connect the dots the last day when everything of the biopsychosocial model went together well. And this is the way I'm thinking personally on managing patients in a holistic fashion with diet and with anti-inflammatory supplements. I really enjoyed it because it makes so much sense all together.
So have you had ASTR treatment in the class? Did you have pain? Did you have restricted range of motion? And what did you feel after the treatment, if you had treatment from someone took the class?
In fact, I only had a little pain, but on the left leg I had a little pain, and it felt like a relief, and I was becoming aware of all the granular and all the fibrosis I have on the backside of my legs. And I'm looking forward to managing myself in the next weeks with ASTR treatment, and I will see how far I can shave away this fibrosis on my tendons.
Did you feel any difference in the range of motion when you had worked on you?
Definitely, and much looser than
Mm-hmm.
muscles.
That's good, yeah. So do you feel after finishing the 3 days class, do you feel the class is enough to prepare you to practice tomorrow using ASTR concept and instrument, or do you feel you need more training?
Definitely, and I was impressed on the amount of work in your handouts
Mm-hmm.
and the practicability to just use it right off the grid, like off the shelf. Just take it, use it, and go ahead with it. So obviously I only had like 2 or 3 tests,
Mm-hmm.
Test sessions, but it was
You mean you had 2-3 treatments?
treatments
Yeah.
with the other participants, but
Mhm.
it was definitely very, very well organized,
Mhm.
impressive.
Do you feel you're competent to implement ASTR?
Yeah,
Okay,
definitely.
awesome. So what do you say to other colleagues like chiropractor or naturopathics about ASTR class? What your thought about it?
I think it's worth doing the ASTR class because it has this holistic approach, and things can only get better if systemic things get better. If the system's rotten, things will not get better. And it's nice having the tools, and it's nice having the foundation helping the people.
What do you think about after learning ASTR? How that gonna change the way you practice with patient?
In fact, not that much, because I already do a lot of nutrition and supplements and anti-inflammatory diet, which I consider and which make that much sense to me, and which what was the appeal of ASTR to me. And everything I was
So what's different that you take from ASTR that you have not been doing,
definitely
other than the diet?
the tools are a big enhancement. I did the myofascial release before, and the tools are a big leap towards more productivity.
More productivity.
Yeah.
All right. So can you tell me like what kind of like technique you used to use before ASTR?
Like, what kind of what?
What kind of manual technique you used to use before ASTR?
So of course I use massage, I use chiropractic, I use osteopathy, I use acupuncture, and I use the myofascial release, as I learned from Art Riggs, which is a little in the direction, but ASTR definitely is a much faster, much more intense approach to just focusing on the problem.
On the problem. And can you tell the difference with the result when you work with patient using ASTR?
Just faster. Definitely much faster and very precise. So I like that.
All right, awesome. Thank you so much. Glad to have you.
Dr. J.K.
Thank you.